For young and healthy people to be vaccinated is essential for us to get through this pandemic. Even though you may not be one of the people at risk for being hospitalized, you may not be one of the people at risk for death, you are potentially spreading the disease. And for us to get through this pandemic, our young, healthy individuals are the key. Young and healthy people have been hospitalized. We have had young people, unfortunately, die at a much lower rate. So nobody is completely immune to the disease, but we do have a responsibility to those around us and for keeping ourselves safe. The vaccine is safe. Even though it seems like it came to market very quickly, the mRNA vaccine technology has been there for several years, and it was in place at the right time so that we could get COVID stamped out very quickly. If we waited years and years to do trials for this vaccine, we would be in terrible shape right now. We wouldn't be going back into public. We wouldn't be reopening. So we know that the vaccine is safe. The technology has been there for a long time. We have hundreds of millions of doses in arms with people doing well and getting out of this pandemic. There's a lot of rumors on the internet about vaccines, vaccines in general, but more specifically around COVID vaccines. It does not cause infertility. It does not cause any change in your DNA. It doesn't have any impact on those organ systems whatsoever. It simply interacts with your immune system to protect you from COVID, so that if you do get exposed, you don't get sick from it. The more common side effects that we see, some people get a little injection site reaction, a little sore arm for a day or two, very manageable. People are variable as far as having a little body ache, fever, fatigue, or chills. Most of that lasts about 24 hours. Staying well hydrated, rested, and a little bit of Tylenol. We've seen no long-term complications from the vaccine where we are, and we have given hundreds of thousands of doses at this point. So very minimal side effects, but very much worth it and much better than having the disease itself. The research is still ongoing with boosters, and what we have to figure out is what is COVID going to look like in the next several months. We hear of things called variants, and so we hear variants named after certain places, and now we're seeing variants named after the Greek alphabet in the order of which they're determined. With the more we're susceptible to the disease and the more we spread the disease, the more likely we are to have variants. The more likely that we have variants and we allow them to continue to spread, the more likely we will be to have booster vaccines or need booster vaccines in the future. Right now, the immunity, the longevity of that immunity from our vaccines that we have in our pocket is great, and it is getting us through this pandemic, but we have to do more. We need more people vaccinated because we're still seeing cases. I've been here since the inception. This has been 471 days of Health Command now. But one of the things that I've seen is that the community coming together was so essential in us getting those vaccines into arms, and we did so well for so long, and we're still catching up. We need that last 10 to 15% so that we can get that community immunity. One of the hardest things that I had to do during the pandemic is report deaths. And it seemed like for months we were reporting several deaths every day for days and days on end, and looking at hospital numbers going up, watching people be on ventilators. And so since the inception of that vaccine, since we gave the first dose in December of 2020, we've steadily seen the hospitalizations go down. We're not making death announcements every day. Now, out of that, we've got to be respectful of the people that have lost their lives to COVID. We need to finish this for them so that we didn't do this for nothing. But we have seen where we very aggressively vaccinated the 80 and over population. They're not dying at the rate that they were. They're not being hospitalized at the rate that we were. We still see outbreaks, and most of those are in younger adults, and so it's imperative that our young adults get vaccinated because we want to get back to normal. We don't want to be in our houses. We don't want to do Zoom meetings for years to come. We want to be in person, and the way to do that and to be safe, get your vaccine.